Here are your notes on the heart. Okay, this is the first section. There's 4 different section of notes on the heart we'll go through. Okay, starting with here. So the heart, as we all know, okay, is a muscular organ that pumps blood through our body. The pericardium, okay, which is a fluid-filled sac, surrounds the heart, okay, and prevents friction while the heart pumps between ribs or anything else that might be there. Okay, it has 2 parallel pumps separated by a septum. So septum's in the middle of your heart, and then the 2 parallel pumps. The pump on the right receives deoxygenated blood from the body tissue, so that's all the blood that gets pumped back after it goes through your circulatory system and oxygen is taken out, and we call that, or then it pumps it to the lungs, and we call that side the pulmonary circuit. Okay, the pump on the left receives oxygenated blood from the lungs and then pumps it to all of the cells of our body, and that's the systemic circuit. So as you can see here, blood from our systemic circuit, okay, gets pumped up and up through the lungs to gain oxygen. It becomes, the red shows it's oxygenated, okay, and then it goes through the pulmonary circuit that then pumps it to the systemic circuit throughout our whole body. And so, okay, so the blood that carries the blood to and from the lungs is our pulmonary circuit. Okay, so it comes from the pulmonary circuit, okay, into our heart, and then when it goes out of our heart to the lungs, that's our pulmonary circuit also. Okay, the systemic circuit is now, once the blood comes from our lungs, okay, it needs to be pumped through the aorta, which is our most major artery in our body, okay, to all of the different capillary beds, okay, in our whole body. Okay, the human heart has 4 chambers. Okay, we have 2 thin-walled aorta and 2 thick-walled ventricles. The blood from the systemic system enters the right atrium, while the blood from the pulmonary system enters the left atrium. And the ventricles then pump the blood to the distant tissues. Blood is carried to the heart by veins. Okay, the superior vena cava, okay, carries the deoxygenated blood from the head and upper body down to your heart, and the inferior vena cava is the major vein that carries all the deoxygenated blood from the veins below the diaphragm. Yeah, oxygenated blood enters the heart through the pulmonary veins. Blood then goes from the aorta to the ventricles. The atrioventricular valves separate the atria from the ventricles, and the AV valve stops the blood from going back into the atria. So as it enters into our, from our body or through our pulmonary veins, then the blood goes to atria, then it's pumped into the ventricles. The AV valves are what stop it from going back into the atria. Okay, the semilunar valves separate the ventricles from the arteries. So again, as it's pumped through the ventricles out into your arteries, we don't want any blood kind of going back the other way. They look like a half moon and prevent the blood from falling back into the ventricles after they have entered our arteries. As the blood leaves the heart via the arteries, the aorta, which again is our largest artery in our body, carries the oxygenated blood away from the heart. The coronary arteries come off the aorta and then supply the muscle cells of the heart with oxygen and nutrients. Okay, when these arteries become blocked, the heart pain can occur due to lack of oxygen. And we talked about kind of what blocked them in the last set of notes on the circulatory system. Okay, the heart must continue to beat no matter what to ensure the whole body, including itself, gets the oxygen it needs. And so that's where when we get fat deposits and plaque build up inside our coronary arteries, okay, if left untreated, again, can lead to heart attacks and death. Okay, medications can be taken to increase the blood flow, but in severe cases, surgery might be needed to unblock uh, the arteries. The coronary artery bypass surgery takes a vein from another part of the body and puts it in the heart. So basically, you're taking like the tube part of the vein and then just replacing the artery with that. During this operation, the heart must be stopped and they must put a bypass. So that's why this operation is extremely risky. You're stopping the heart, and so you want to, that's never a good thing. All right, that's end of these notes. The heart part 2 will be coming up next.